Welcome to Technique Tuesday. This month we're going to be studying the hip. So today we're going to go over two things to test or to use to determine if you have a hip flexor strain or if you have a groin strain or an adductor strain. I get the two confused quite often from patients. They say they have a groin strain when really they have a hip flexor strain, and vice versa. So it's important to know the difference between the two. So I'm going to show you two tests to determine if you have a hip flexor strain or a groin strain, and then I'm going to show you a stretch or an exercise to help with those. So the first is whether or not you have a hip flexor strain or a groin strain. So the hip flexor muscles are ones that bring your knee up or flex the hip forward. So to test if you have one of those, raise your knee up and then push down and resist it. If you have more pain or your symptom pain, that means you have a hip flexor strain. If you have an adductor strain or a groin strain, do two fists together, put them between your knees and squeeze. If that reproduces your pain on that side, that means you have an adductor strain or a groin strain. If you have a hip flexor strain, a good stretch to do with that, and this is just a light stretch, you don't want to go into a lot of pain, just a little bit. Stand like this. This is the side that's hurt or affected. This is the one that goes down that you kneel on. Put a cushion down so you don't have too much pain through your knee. Stand big and tall. What you're going to do is kind of tip your pelvis backwards, like if you're wearing a belt, try and bring your belt buckle up towards your chin, and then just lean forward, kind of push forward with your hips. You should feel a stretch all down the front of your thigh. Keep it nice and light, keep it easy. Don't go into very much pain or discomfort at all with that if you have symptoms there, okay? Typically hold about 30 seconds 3 times. For the adductor strain, a simple one is in standing. Spread your feet out about just outside of shoulder width, so a little bit wider. And if this is the side that I've strained or I've injured, I'm going to tip towards that side with my shoulders, okay? Easy stretch this way, and you can do both sides. But you want to stretch the side that is painful or affected, but always do both, holding 30 seconds 3 times. This is an easy one, and the other one is one you're probably all familiar with, bringing your feet in together, a butterfly stretch, big and tall, and pushing down with your elbows on your knees, doing that 30 seconds 3 times. Great, hope those two help. Look forward to more videos about the hip and how to take care of the hip the rest of this month. Have a great day.